So just to conclude task 21, which is the postmortem exam with necropsy with one of my DVMs, I have all of my samples and supplies here that I'll go over in just a moment. After I stopped the last video, I kind of just sutured up Sonny with the doctor and got him packaged up and put him over in the freezer for the crematory service to come pick him up. So for now, I have all my results from the necropsy written down right here that I took note of as we were doing the necropsy just a little while ago with Doc. So as an overall result, our spleen was normal. There was a split noted, but Doc said that he believes it's from postmortem changes. Pancreas was normal. Small and large intestines was all normal. The bladder was normal. The left and the right kidney were normal sized. Colon was flaccid. We didn't see any contents in the colon. Stomach was distended more than normal, so we did take a sample of that right here. Liver was normal. Gallbladder was normal. Again, the omentum for the most part was normal, but we did find a little cluster of lymph nodes that were larger than normal. So that's our second sample over here that we're going to be sending out. So this is all the results that I have written down that we will be getting scanned into our record or into our system, so it's in the patient's record. So any of the results that come back, we have the notes from when we did the necropsy. If we were to have gone into the thoracic cavity on the necropsy, Doc didn't feel the need to since the cat was having vomiting, diarrhea. We were more interested in the abdominal cavity and the GI tract to see if there was any changes there. But however, if we were to have gone into the thoracic cavity, we would have made sure that there was negative pressure going through the diaphragm into the thoracic cavity. We would be able to examine the lungs, the trachea, the esophagus, the heart, the pericardial chamber, see what changes or if anything would have been noted in the thoracic cavity. But again, we stuck with the abdominal cavity, which luckily yet unfortunately for this cat came back mostly within normal limits. So again, I'm just going to put this on the side over here. I'm going to have one of our receptionists at the front desk scan this into our system so it can be placed in the patient's record. Okay, so then over here I have all of my supplies. So I have my lab form. We use Antec, and the doctor wrote the history at the bottom, just saying what the two samples are, which we're sending a sample of the stomach and the enlarged lymph nodes. So we're going to go ahead and just fold that. I like to fold it that way. This way you have all the patient information here and what the test is being run. And we're just going to put that into one of the Antec bags. Okay, and we're just going to package that all the way up. This way it kind of has its own protective case. So then each of my samples, I've printed out a couple of patient labels that I'm just going to put onto the samples. So again, this is my stomach sample. So I'm going to go ahead and put on the patient label. Get my pen. I just want to make sure that I write that this is the stomach. And on the sheet it was noted as stomach sample is number 1, so I'm going to put a number 1 on there with today's date. Okay, make sure that's nice and tight. And we're going to put this into its own bag. Just in case during travel there's any cracks or leaks or anything, it should all be contained within this bag. So we're going to get out most of the air. We're going to make sure it's zipped all the way shut. And then I go like this to make it tight. And then I'll take a little piece of tape. Okay, so that's going to be our stomach sample. And then I'm going to do the same thing with my other sample here. So again, this was the lymph node sample. So the lid is nice and tight. We're just going to put the patient label on. And then we're just going to write lymph node. And number 2, because on our lab request sheet, the lymph node sample was the number 2. And again, we're going to put this guy in his own little bag as well, just in case there's any cracks in the bottle during travel or any spillage or anything, which usually there's not, but just in case, nothing will get contaminated. Okay. A little piece of tape just to keep it nice and confined. Okay, So then again, we have both of our samples labeled properly with the patient information and the sample that it was in their own bags. We have our lab request in our own bag so that if the contents do spill, that the lab request form will not get destroyed. So we're going to go ahead and put the lab request into another bag, and then both of our samples, which is the stomach and the lymph nodes, will go in here as well. We're just going to get the air out. Okay. We are zip locked. Okay. So as you see, we got our lab form with our samples. So it's going okay to bring over to where our other samples are. We're going to send it out today and see what the lab comes back with, if they have any findings that we can't see with the physical eye from our necropsy that we just did on Sunny. Okay, so that is how you perform task 21, which is just doing a post-mortem exam with a necropsy with a DVM.